Let's see the adjustment of the downward facing dog as a teacher, as a partner, how we can assisting our friends, our student in this asana. So it's called Adho Mukha Svanasana. Adho means a down or downward. Mukha is a face. And Swana is a dog. So it's called a downward facing dog or down facing dog. So any posture, wherever you see the Adho means a downward, or Mukha is a face. So as I just said, I'm doing the Adho Mukha Sukhasana, the downward facing cross leg position or downward facing easy position. So we can combine the name, or we can create some different name or different asana. So in Adho Mukha Svanasana, when you're practicing the Adho Mukha Svanasana, it's as I said that day, it's we are working on the extension of the spine. Okay, we are working on the extension of our posterior body. So the back part of the body, from the heels to the hips, and hips to the shoulder, or shoulder to the wrist. We're working on the extension. But see what happened, if most of the time we get the stretch, of course we get the stretch on our shoulder, on our lower spine, but these are sacrum region and the glutes. If the hips are like not really pointed direction, so what happened, it get the roundness from here. Okay, we get the roundness on the sacrum spine, and we don't get the, especially from the lumbar to the buttocks. This area remain be passive when you do the Adho Mukha Svanasana. As you do the big downward facing dog, automatically you will have the more space in this region. It will help you to increase the extension on the sacrum spine and the lumbar region. Okay, let's see now how, as a teacher, how we can assisting somebody in Adho Mukha Svanasana. A little bit alignment. Can somebody do the downward facing dog, please? Anyone? Do the Adho Mukha Svanasana, please. So there are many ways to get into the Adho Mukha Svanasana. Let's see the one of the way, as we do in Hatha Yoga, from the Balasana, from the child pose. So from the Balasana position, you adjust yourself nicely. See the movement of your hands and your fingers here. You spread your fingers nicely, first of all, like that. Just imagine that you're going to keep your thumb pointing towards each other. Okay, your big finger. What happened? Why are you laughing? So your big finger pointing directly front direction to the top of the mat, and your pinky finger, stretch your pinky finger out to the direction to the sides of the mat. Okay, this three direction. Okay, so thumbs to each other, your big finger pointing front, and your pinky finger pointing to the sides of the mat. So try to stretch your fingers completely, nicely. Try to get the nice deep stretch to the wrap of the thumb, your entire palm. Okay, so they are nerve root ending. So try to press those parts strongly, will helping us to improving the blood circulation immediately. Okay, and you will feel a fully energetic. So stretching the fingers out nicely, your shoulders moving slightly away from the ear. Make sure that you're not collapsing them in this position, otherwise neck becomes so tensed like that. You're gonna keep your upper arms a little bit out away from the ear. You can lift your head up. You look front, rolling the upper arms out. Now, so from this position, you lift yourself up and come into the kneeling position. Stay there for a bit. Press the palm and lift your shoulder high away from the floor. Very nice. Now you tuck your toes underneath your heels. Open your feet hip width apart. Second step here, you lift your knees high away from the ground. Up, 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 up. Stay there for a bit. Knees remain bent. Now third step, remember what I said in the downward facing dog? You're trying to tilt your hips forward. Wait, yeah, tilt forward. Yeah, tailbone high, and then you move your chest with the exhalation towards the thigh. So stay there, hold it for a bit. Perfect. So as you push it, you can relax your head down now. So as you push your chest towards the thigh, what happens it does, it really helping us to get the stretch in the armpit region, your triceps region. It get fully stretched in this position, shoulder get fully stretched, and also it helping us to keep the back straight. If somebody have the stiffness on the shoulder, see how the downward facing dog looks like? The downward facing dog looks like that, right? Because of the stiffness on the shoulder. So as you start to pushing your chest this direction back to the thigh, it helps us to make our back flat, and also helping us to open our front of the chest, the sides of the chest, our armpit and triceps region. Okay, it get the fully stretch from the armpit to the waistline. Now see here, as you keep your back straight, first action, what you're going to do, working onto, keep your knee bent, relax. You are in hurry?
No, sir.
You alright?
Yeah, I'm okay.
Okay, try again. Stay there. Hold your feet. Just breathe. It's a very relaxing posture, isn't it?
No.
Yeah. Stay there. So you're going to keep your back straight, and first action, what you're going to do after that, trying to stretch from the sides of the body. So how you're going to stretch? You're trying to push from the top of the thighs like really strongly back like that. So as you push, As you push from the top of the thighs back, you elongate your sides of the trunk. So your sides of the trunk become fully length, your spine become longer, your back is already straight. Now the challenge is to touch the heels down. So without disturbing the back, stay there. Without disturbing your entire back, you're going to press the heels down to the floor slowly as much possible. But make sure your toes are slightly moving inward. Your hands are slippery? Okay, then hold the sides of the mat then, like that. You can hold like that with the both hands. Okay, once again. So you push the top of the thighs backward, yeah, like that, this action. If you do not make the space from here, otherwise this portion from the lumbar to the sacrum region, the tailbone, it becomes shorter. So as you start to pushing from the top, it really helping us to extend our sacrum spine. Push the top of the thigh back, straight the leg and pressing the heels down as much possible. Now once easier, if you find somebody the heels are lifting up like that, they cannot push themselves more down. So how are you going to help them? See, I'm not going to press her heel like that, okay? So I'm going to help her to lift her weight, shift her weight more back towards her leg. So how I'm going to help her now? I come in front of her, I can do the strap, I can do with the strap or I can do with my hands. Let's try with the strap first. So see how I'm going to shift the body weight. As the whole body weight comes back to the lower part, it becomes easier to bring the heels down to the floor. So I take the strap here, I'm going to hook the strap on her top of the thigh like that. And I keep my one foot between her calf muscle like that. So I hold the strap tightly with my hand. I will ask her for the inhalation and I pull her weight backward. Can you feel your weight on your legs? Yeah. So hands become very soft in this position and all the weight goes to the legs and it's easier to touch the heels down. First adjustment you can try like that. Or the same way we do, stay there, breathe, keep breathing. Very nice, stay there, you're doing very good. Hold it for a second. Next exercise we can try from the front side. So I take my one foot between her hand and I keep my one leg back. So similar like a child pose, I keeping my hand on her waistline like that. Fingers pointing out, thumb pointing up. And I'm going to keep my shoulder a little bit lower here. If I keep my shoulder up, so for me it's hard to lift her up. So I keep my shoulder a little bit lower from this position, at least a level with her pelvic region. I will ask her for the inhalation. As she inhale, I'll try to lift her up in this position, keeping her spine higher or straight. Okay, can you feel the weight on your feet more now? And also the hands become light, right? The hands become completely light in this position. So much pressure on the legs and the less pressure on your arms. Okay, so it helping us to extend the spine and make the spine longer first. Stay there. Now second adjustment. Now if you see if somebody having the roundness on the back or having the stiff shoulder, even we can use the other hand to stretch their back, but slowly. How? And if somebody collapsing the shoulder, so we can use our hands some directional touch, like spread your fingers, yeah, spread the shoulder out, like try to move the hands on the shoulder blade, make them aware, spread the shoulder blade. After that, you use your hand very slowly to push the chest backward direction, and very gently, not so much, and very gently. Now, also if you see somebody cleansing the finger like they are all the time keeping the finger relaxed like that, and now you see, can you do one more time like that? No, just do. Okay, now see, look at here. What happened in this position? For example, if I do the downward facing dog like that, so all the weight comes to my heel of the palm. Okay, so it gives a lot of tension to the heel of the palm. So I start to having the stress on the wrist and wrist pain then. So that's why all the time saying press the finger or spread your fingers or press the palm on the floor. So as you start to pressing this area, it reduces the pressure from the back of the heel. Okay, same with the feet. So as you start to pressing the mounts of your fingers, so it's helping us reduce the pressure from the wrist. Okay, so as you're doing like that, so if you're seeing some person doing like that, we can give them some directional touch. Can you please put your hand like that? Like you can give them some tapping on their hand. Okay, spread your finger, go close to them, spread your finger. Okay, if they don't spread their fingers, so maybe one time you boom, a lot of pressure, make them, I'm just kidding, okay, no, I'm just kidding, no, but very softly can make them aware. Okay, spread your finger, press the finger, go close to them, some tapping to some directional touch, press your finger. Or if they doesn't listen you all the time, you have to one time maybe you really need to give a lot of pressure, a little bit, and then release. Okay, these three adjustments we can do, one with the strap, another with the hand lifting upward, and third with the one hand on the back, another hand pushing the chest a little bit slowly. All right? Okay? Adho Mukha Svanasana. You okay?
Yes.
Yeah? Good. Okay. Okay, let's try now.